morning, students. Myself, Dr. Ritika Singh, Assistant Physiotherapist in Suresh Ganvihar University. Today, as you all know, bridge course is going on, and this is the day 2 of bridge course. I'm going to take a topic of Introduction to Anatomy, which is a basic and very important subject in physiotherapy. So, what is anatomy? Anatomy is a science dealing with the structure of human body. It is derived from a Greek word anatomy, mean cutting up, or as a Latin word, it says dissection word, which is used. But the basic meaning of anatomy is the study of body. Now, the subdivisions of anatomy. There are basic subdivisions or classification in which we are going to study about different parts of the anatomy or the body. First, cadaver anatomy, living anatomy, embryology, histology, surface anatomy, radiographic anatomy, comparative anatomy, physical anthropology, applied anatomy, experimental anatomy, and genetics. These are all the branches in which we are going to study about the different parts of the body. First, cadaveric anatomy. In this, we study done on dead bodies which are preserved and can be seen by the naked eyes, also known as gross anatomy. In this study by two approaches. First is the regional anatomy and the second one is the systemic anatomy. In regional anatomy, we study about the different parts of the body like upper limb, upper part of the body, lower limb, lower part, legs of the body, thorax, abdomen, head and neck. These are all divided in different parts. Second one is the systemic anatomy, in which deals with the organs or system of the body. Muscular system related to muscles, which is known as myology. Articular system, which known as arthrology, in which we study about the bone, joints, function, and its structures. Skeletal system, osteology, related to bone study. Vascular system, in which we study about the vessels. Nervous system, in which we study about the nerves or the central nervous system. And peripheral nervous system, as you all know about the central nervous system, it includes brain and spine, and the peripheral nervous system, which includes the other part of the body. Then respiratory, digestive, and urogenital system. Second is the living anatomy. This system involves study of living organism. It involves inspection, palpation, percussion, and auscultation. In inspection, we study about the checking and observing without touching the patient. We just examine and assess the patient without touching. In the palpation, it is the method of feeling with the fingers or hands during a physical examination. We just touch the patient and feel and examine the size, consistency, texture, location, and tenderness of an organ or part of the body. In percussion, method of tapping body parts with the fingers or hands or as a part of physical examination. We just tap the body part to feel by fingers or hands and done the examination. In auscultation, as we all have seen by stethoscope, the internal sounds of the heart and the lungs are diagnosed or feel by the auscultation process. Third one is the embryology. In the embryology, we study about the prenatal development of sex cells during fertilization and development of embryo or fetus. It is divided into two, that is ontogeny and phylogeny, also known as osteogenesis It is the origination and development of physical, psychological, usually from time of fertilization of an egg to an adult. In ontogeny, we study about the fertilization of till the development to its adult. In phylogeny, it is the study of relationship between the different group of organisms and their evolutionary development. Fourth one is the histology, also known as microscopic anatomy, in which we study about the different structures with the help of microscope. As you all have studied in your 12th, that we study a structure of a cell with the help of microscope, where we you all see about the nucleus, Golgi apparatus, mitochondria, and etc. Surface anatomy. It is also known as topographic anatomy. It is the study of deeper parts of body in relation to the skin surfaces, like about your clavicle, where it is located, and about the scapula, about the shoulder. These all are done by the surface anatomy. Then radiographic and imaging anatomy, in which we study about the different structures according to the MRI, X-ray, ultrasound. The deep structures are studied. Comparative anatomy. This is the study of anatomy comparing animals to humans. It is the study in which we study about similarities and differences of the different species. Physical anthropology. It is scientific discipline concerned with biological and behavioral aspect of human beings. As we all know, our ancestors are Homo sapiens, and then its development from Homo sapiens to the humans. These all are studied under physical anthropology. Then applied anatomy, also known as clinical anatomy. In this, application of knowledge of human anatomy will be used to diagnose and treat the patient. Experimental anatomy is used to target or experiments involving a anatomical structure. It is carried to collect more information about the respective anatomical structure and its function. Then genetics. It is a branch of biology concerned with the study of genes like DNA, RNA, which are related to the heredity in the organism. Though heredity has been observed for millennia, Georgia Mendel, Morven scientist, and Augustinian friar working in 19th century was the first to study genetics, the history of anatomy. Hippocrates is called as the father of medicine and the founder of anatomy. Herophilus, father of anatomy and first one to dissect human body. Mendes taught anatomy of dissection. Leonardo da Vinci introduced cross-sectional anatomy. William Harvey discovered circulation of blood. Röntgen in 1895 discovered X-ray. Discovery of microscope is done by Jacques Janssen. Discovery of ultrasound and Donald. Discovery of CT scan, Godfrey Hausenfeld and Dr. Alan Cormack. Discovery of MRI by Paul C. Lauterbach. Now the basic nomenclature which is used in anatomy. Following 6 rules were strictly followed to give their names. Each part shall have one name. Each part in the body has given one name. Each term shall be a Latin. Each term is short and simple. Term must be memory sign. Related terms must be similar. Adjectives shall be arranged as opposite. It is a collection of terms revised by Basic Nomenclature and Brigham revision made by International Congress of Anatomists in New York. Now the language and terms which we are going to use in anatomy are the anatomical positions. First one is the anatomical position. It is the position of the body in which body is in upright, directly facing the observer, eyes looking forward, shoulder leveled, feet flat and directed forward, and the palm are facing forward. As you all can see in the image also, palm is facing forward and shoulder are level and body is in upright position. This is known as the anatomical position. Second is the supine position, which means lying horizontally with the face, torso facing up. It grants access to the peritoneal, thoracic, and pericardial regions as head, neck, and extremities are held in the horizontal position. Prone position is a position of a body in which the person lies flat with the chest down and the back up. Lithotomy position is used during the childbirth and surgery in the pelvic area. In this, the legs are flexed to 90 degree and knees bent to 70 to 90 degree and padded footrest attached to the table with your legs. Axis and plane. We all have studied in physics about the axis and the plane. Axis is an imaginary line in the body around which the movement takes place. Earth moves around its axis, and plane it is an imaginary line in which the direction of the distal component of joint moves, and it also divides the body into various parts. Axis and plane both are perpendicular to each other. Axes are sagittal, frontal, and vertical axis. Planes are frontal, sagittal, and transverse or horizontal plane. Frontal plane, which divides the body into front or back, which also known as the anterior part as front part and the posterior part as the back part. Sagittal plane divides the body into left or right part. Transverse or horizontal, which divides the body into superior or inferior, means the up or down part. And the movement which takes place according to these axis and plane in frontal plane, abduction and adduction, sagittal, flexion and extension, transverse, internal, external, rotation, movement and pronation and supination. Am I audible? Okay, basic terminology. What are the terms which we are going to use or which we use during the study of anatomy? Anterior, in the front. Anterior means the front of the body, and the posterior is the back part of the body. Medial, the direction towards the midline, towards the body, and the lateral is direction away from the midline of the body. Superior is near the head and inferior away from the head. Superficial, close to skin or the layer of the outermost layer of skin. Deep is away or deep inside the skin. Ipsilateral, on the same side of the body. Contralateral is opposite of the body. Invagination is projecting inside and evagination is projecting outside of the body. Medial border, edge along the little finger, medial border of forearm and arm, and lateral border is the edge following the thumb. The thumb side is called as the lateral side and your little finger side is called as the medial side. The palmar is front of the palm and dorsal side is the back of the hand. Flexor, front of limbs. Extensor, back of limbs. Flexion, when two flexor surfaces brought together. When the front of the front surface, which is known as the flexor surface, is brought together, then it is known as flexion. And when the extensors or the back surfaces are brought together at maximum approximation, then it is known as the extension. Abduction, this is the movement when limb is taken away from the body or apart from the body. Adduction, when limb is taken closer to the body. Suppose when you move your head towards the body or the side of the body, then it is known as adduction. And when you move away your hand from the body, then it is abduction. Medial rotation, when limb rotates internally or at vertical axis of bone rotates anti-clockwise direction. Lateral rotation, when limb rotates externally and rotates in the clockwise direction. Supination, palm facing upward to sky. Pronation, palm facing towards the ground. Opposition, when thumb touches small opposite finger. When your thumb touches to the little finger, then it is known as opposition. Circumduction, when a joint moves in all direction. When you move your shoulder in 360-degree direction, then it is known as circumduction. Plantar flexion, when plantar surface faces the ground. When your foot faces the ground, then it is known as plantar flexion. When dorsiflexion, when dorsum of the foot. Then inversion, when medial border of foot raised, and eversion, when the lateral border or your little finger side border is raised, it is known as eversion. Lateral flexion occurs in spine bending towards one side. When you bend your spine towards one side, then it is known as lateral flexion. Protraction, when joint or distal component slides towards forward the fixed proximal part. When you move your shoulders towards the front, then it is known as protraction. And when you move your shoulder joints or the distal component slides backward to the fixed proximal part, then it is known as retraction. Types of body movements. Gliding movement, when flat surface of bone slides over the other, it is known as gliding movement. Suppose when you wave your hand, then it is known as the sliding movement, because the flat surface of one bone glides over the surface of other bone. Angular movement, when angle between the articular surface increases or decreases. Like example, flexion, extension, abduction, adduction, these all are the angular movements. When we do these movements, then the angle is decreased or increased during the movement. Suppose when you raise your hand up to the sky level, then flexion is done or your angle is increased. So this is called as angular movement. Rotation, when bone revolve on its own longitudinal axis, is called rotation movement. Medial or lateral rotation, when you move your hand or forearm towards the outside, then it is lateral rotation. And when it moves towards the internal side, then it is medial rotation or rotation of your neck. Then there are some special movements which are known as pronation, supination, protraction, retraction. Pronation, supination of forearm, when your palm is facing towards the sky, then it is known as supination. And when your palm is facing downward, the is known as pronation. Then protraction and retraction, terms which are used for muscles, vessels, and bones. Origin, the location from where the muscle starts. This end is relatively fixed during its contraction. Origin is the part where the muscles originate and starts, and it is fixed during its contraction movement. Insertion is the location where the muscle ends and it moves during the contraction of the muscle. Belly, flesh thick part of the muscle. Tendon, non-contractile cord-like structure connecting muscle to the bone. Tendon is a non-contractile fibrous cord which connects your bone with the end of the muscles. Aponeurosis is a flattened tendon between the muscles, raphe fibrous band branching around the interdigits and forming the tendons, ligaments, fibrous contractile inelastic band connecting the two bones with each other. You can see over here in the images also that tendon is the narrow band which connects muscle to the bone. Ligament is connection or a band of connective tissue between two bones. And aponeurosis is a flat muscle connecting to the other muscle. Now arteries, vessels carrying oxygenated blood from heart with the other part of the body except the pulmonary and umbilical artery which do not carry the oxygenated blood, veins which carry the deoxygenated blood, capillaries, these are the network of microscopic vessels connecting the arteries to the venules. Anastomosis, it is the pre-capillary or post-capillary communication between the neighboring vessels, means it is the connection made between the pre and the post capillaries. Depression, it can be a pit, fossa, or any groove or a depression. Opening like foramen canal, aqueduct, cavities, hollow space within the bone is called sinus. Smooth articular areas, it may be facet, condyle, head, capitulum, and trachea. Anastomosis. It is the point where two blood vessels merges. It can be arteriovenous anastomosis, where artery flows directly into vein. Venous anastomosis, vein empties directly into other vein. And arterial anastomosis, two arteries merges. Elevation in bone, linear elevation, or there is a edge or elevation is there, linear crest on bone, sharp elevation, maybe flat sharp edge surface, rounded. These elevation may be tubercular, tuberosity, epicondyle, malleolus or trochanter. Now there are some terms in clinicals. Itis means inflammation. Ectomy means removal of the part from the body. Appendectomy, autonomy means to open and then close a hollow organ. Laparotomy. Oma means a tumor. Puberty, at age at which secondary sexual characters develop for girls. 12 to 15 and 13 to 16 for boys. Symptoms complained by the patients in his own language. Signs, finding of the doctor on the patient, it is objective in nature. Diagnosis, identification of diseases. Prognosis, we tell the probable course and outcome of all the diseases. Pyrexia, fever, lesion means injury, inflammation, localized reaction, or body response to external stimuli. Signs of inflammation are redness, temperature, swelling, pain, and functional loss. Edema is the accumulation of fluid in tissue. Thrombosis, intravascular coagulation of blood. Embolism, occlusion by detached thrombus. Hemorrhage, bleeding or loss of blood. Ulcer, erosion of skin surface. Sinus, a blind tract lined by epithelium. Fistula, a tract open at both the ends. And necrosis, local death of the tissue. degeneration, deterioration in structural and functional qualities of cell, gangrene, necrosis, infarction, death of the tissue due to loss of oxygen, atrophy, decreased size cell, dystrophy, decreased size due to defective nutrition, hypertrophy, increase in the size without an increase in number of cells. These all are the terms which are used in anatomy. Hyperplasia, increase in size due to increase in number of cells. Hypoplasia, incomplete development. Aplasia, failure of development. Syndrome, a group with many disease and signs and symptoms. Paralysis, loss of motor power of body. Hemiplegia, half body paralysis into right or left side. Paraplegia, paralysis of both the lower limbs. Monoplegia, paralysis of one side of limb. Quadriplegia, paralysis of all the four limbs, both hands and both legs. Anesthesia, loss of touch sensation. Analgesia, loss of pain sensation. Thromboanesthesia, loss of temperature. Hyperesthesia, increased sensibility. Paresthesia is an abnormal sensation of the skin like tingling, prickling, and burning sensation which patient or feel in the body. Coma, deep unconsciousness, tumor, non-inflammatory abdominal growth of cells, benign, disease or illness not harmful, malignant, severe from growth and illness, carcinoma, malignant growth arising from epithelium, cancer, term for any malignant neoplasm, metastasis, spread of disease to distal part, convalescence, recovery period, neoplasm. A neoplasm is a type of abnormal and excessive growth. There are few more positions that Trendelberg position. In this, the body is laid in supine or flat on the back on a 15 to 30 degree, as you all can see in the image also, with the feet elevated above the head. This is position which is used for laparoscopic surgery of lower abdomen and pelvis. Then reverse Trendelberg position. The reverse Trendelberg position is opposite to the Trendelberg position where the body is supine on an incline but with the head now being elevated. Patient is kept in position to expose the prostate and upper abdominal region during surgery. This position is good for performing procedure in head and neck. So this is all about the introduction of anatomy or the terms which we are going to use in the study during the anatomy. I hope all of you have understand about the introduction of anatomy. Is there any queries or questions you can ask? Okay. Thank you all.